Hi, everyone, and welcome back to Wisdom Wednesday. I am Dorothy Dorton with AARP Alabama, and today we are going to be talking about Medicare Open Enrollment. It comes around every year. There's some big changes this year, and we've got a wonderful guest who is back with us today to talk about that. And before we get started on that, I want to tell you a little bit about what AARP Alabama is and what we do, and we empower people to choose how they live as they age. So we are nonpartisan 501c4, and we have over 420,000 members in Alabama alone. Our role is to advocate for those 50 plus and their families. So we're pretty much all inclusive. All right. So with that, I am going to bring in our guest, Mr. James Roberson. Good morning, James.
Good morning, Dorothy. Thanks for having me.
Well, thank you for coming back with us. Some of y'all who have seen Wisdom Wednesday before have probably seen Mr. Roberson on here. Not only is he a good friend of mine, but he is really a guru when it comes to all things Medicare. And he is going to tell you about some valuable free resources that are available throughout the state for folks who are kind of looking at their Medicare plans or getting ready to sign up for Medicare. So James is just a great resource for that. So James, I'm going to let you take it away.
Okay. Sounds good. All right. So again, good morning, everybody. I am James Roberson. I do work for the South Alabama Regional Planning Commission's Area Agency on Aging. I coordinate two programs, actually. One is the State Health Insurance Assistance Program, also known as SHIP. And the other program is the Senior Medicare Patrol Program, which is known as the SMP program. So those are the two programs that we coordinate. We work under the South Alabama Regional Planning Commission, as I mentioned earlier. We cover Mobile County, Baldwin County, and Escambia County, Alabama. We do have 13 planning commissions or council on agings that cover all 67 counties of the state of Alabama. But me specifically, I'm responsible for Mobile, Baldwin, and Escambia County. Next slide, please.
All right. And James, before we get to that next slide, just to note, like you said, this is a statewide program, and there are other folks throughout the state that people can contact if they aren't down here in South Alabama. So that's a great thing to know. And then also, I always like to say this, and I'm going to repeat myself about this because I find this so valuable. Everything James is about to tell you is free, no cost to anyone. So, when you need help with your Medicare stuff, give them a call. So, all right, James, sorry, I just had to to give you another plug. So
I get it.
Tell us about what is SHIP exactly.
Okay, so SHIP actually it actually started in 1990 under what was considered the Omnibus Reconciliation Act. So it's a federal program. It's actually funded by your tax dollars. We as taxpayers all pay into this free, unbiased Medicare counseling service. It's a national network that provides free help to people on Medicare. That's basically our moniker, right? That's why we were founded, to provide this free, unbiased assistance to anyone, caregiver, family member, beneficiary that are dealing with Medicare at any level. Your local SHIP is your resource, your free resource to provide assistance or get assistance from, actually. And the beauty of it is, like you mentioned earlier, Dorothy, all of our services are free. We don't charge anything. It's taxpayer funded. I mean, you've already paid for these services. And our goal is to make sure that people have a unbiased, free place to go to get educated on the Medicare process. How does Medicare work? How do I enroll? These are common questions people have. Questions such as coordination of benefits. I'm retiring from a job. How does my Medicare work with that company? My prescription drugs. What is Part D? How does prescription drugs come into play? What are the costs? Enrollment questions. All of these things, Medicare Advantage versus Medigap supplementals. These are things that people will come into question on, and we are here locally at a local level to help. We are funded by the Administration of Community Living, ACL, and we're administrated through the State Department of Senior Services through what's called ADSS. So our state office is actually in Montgomery, and we're formed of basically committed volunteers and community partners to get the word out on what we do throughout our region here in South Alabama.
Awesome. Let's see. Okay.
So when it comes to what we do, actually how we help, I mentioned that a little bit earlier, but I'll get in a little bit more detail. Most people are not well versed on what Medicare is and how it works. And there's a simple answer for that. And the simple answer is basically, unless you age into Medicare or you become disabled, most people don't deal with Medicare insurance unless they're 65 or older, or they've been deemed disabled. So those are the only groups of people that can even get the Medicare insurance program. So because of that, most of us are used to employer group coverage. We've worked most of our lives. We've been on spouses coverage. We've been on our parents coverage. And then we eventually, or at some point, some of us have our own coverage, obviously, but it's all related to employer group coverage. So most of us are familiar with that. But what happens once we get 65, or we turn 65, or if we're disabled under 65, we get this new way of doing business with insurance. And that new way is considered Medicare, right? And because of that, it's very different for people, and people don't understand the terminology. So what SHIP is here to do is to be your safe spot. We're here to say, hey, look, come to us. Let us help you understand this new way of doing insurance for you. Obviously, Medicare is not new. It's been around for quite some time. It came about in 1965. So it's been with us for quite some time, but all of us have a different time frame of when we use it, right? So many people, like I said, been working 30, 40 years and didn't need it because they had employer group. But we're here to help you, provide assistance with you with prescription drug coverage, Medicare Advantage plan benefits. Now, when I say Medicare Advantage, I'm talking about those private sector programs, Aetna, Viva, Blue Cross Blue Shield, Humana, United Healthcare. These are private entities that have been approved by Medicare to provide you with a service. Many of you may be going to your mailbox today and you'll see plenty of information from them. Well, our job is to help you kind of decipher which one of those plans would work best for you. And there's things that you have to look into for that. So we help with that at a local level. Also, Medigap supplemental policies. Many people confuse Medigap with Medicare Advantage. Those are two different entities. They work differently from one another. Medigap's been around for quite some time. They've been around as long as Medicare themselves. So they're not as marketed as much as maybe the Advantage plans are, but they are still here and they are an option, and they're a great option for some people. So we kind of help people with understanding how those work. Obviously, I mentioned coordination of benefits earlier, and also there's appeals and grievances. Some people have to have decisions appealed. SHIPs help with that as well. We help people appeal decisions that were made by Medicare for whatever reason. We provide that assistance. And lastly, and probably one of the most important ones, is we help people with cost-saving programs. There's a lot of programs that help people save money on Medicare that they may not know about. So we assist with that as well. So ultimately, our job at SHIP is to help you make informed health choices about your insurance. And that's basically who we are and what we do as a SHIP.
I just think, again, I can't say enough about this service and, what you and your volunteers and your staff do and what other, coordinators in the state do. So I think some questions that I might have, and forgive me if I'm jumping ahead, but, even if someone is already on Medicare, but like say their health situation changes, they've just recently been diagnosed with something, like a chronic illness or something, and they want to kind of compare the plan they have now with some possible other plans. So that's something that y'all can help with, right? Like they can call you and say, hey, I've just been diagnosed with this. the doctor's recommended this therapy or this medication, and which plan will give me the best benefit for this.
Absolutely. Absolutely. I mean, that's what we do. We do this 365. Our deal here is people's needs change, people's lives change, things happen in life. People have different medications, different illnesses, change doctors, relocate, move to other areas. Plans that are in the Mobile market are not available in the Nashville, Tennessee market or the Chicago, Illinois market. So we oftentimes have people that are relocating to our area that are Medicare beneficiaries. And now they have to readjust their insurance plans based on where they are. So we are definitely in that business. That's what we do. We help people who are transitioning. Some people lose a spouse. Some people have a financial situation that happens. There's things that happen in people's lives that require an adjustment from an insurance standpoint. And as a ship, what we're so proud of is that we don't have any skin in the game. We're not brokers. We're not sales reps. We actually work for Medicare at a local level to assist people here locally. So our job is to basically make sure that you as a beneficiary are getting the help you need to make informed decisions for yourself. And they're always changing.
I love that. The key word here is unbiased. And like you said, you don't have skin in the game. So you're really here for that person who's calling you and really needs some guidance to make decisions on, their health care.
Absolutely.
I think that's fabulous. So open enrollment this year is October 15th through December 7th. So we are coming up on that time. So tell us a little bit about what's going on this year.
Okay, that's a great point. It is. Open enrollment starts October 15th, as you just mentioned. This is the time of year where many people begin to get phone calls. Their mailbox become inundated with information, right? It's information overload. And this is the time of year that people that are already on Medicare, no matter what plan you have, whatever prescription drug plan you have, whatever Advantage plan you have, whether it's with Humana, Blue Cross, United Healthcare, Aetna, Viva, Cigna, doesn't matter. This is a reevaluation period. And it's very important that you connect with your local ship to have them assist you with reevaluating what you have just because of those changes we mentioned earlier. October 15th through December the 7th is a time for people to reevaluate what they have. So in other words, if you're with a plan now, even if you like it, it's likely to change January 1 of 2024. So open enrollment is a time for you to peep into 2024 to see if the plan that you're currently on will continue to benefit you at that level next year. Okay, so what we do with people is we sit down with you and go over your needs. We go over your medications. We go over your doctor networks. We go over some of your concerns, some of the other things that you may need. And we compare these plans for you so that you can look to see what will benefit you best next year. So you're not making ill-advised decisions over, maybe an overzealous sales rep. Or actually, we see people sometimes that just have good friends that are trying to encourage them to sign up with said plan, but that said plan may not meet your needs. These are very specific decisions.
Right.
We have couples who want to stay with the same plan, but sometimes it may behoove that couple to split because the husband takes different medications than the wife, and the husband also sees different doctors than the wife. So there's some plans that you can join that may fit him better than her, right? Those are things that we want to look out for. We are really excited at the ship office here locally simply because we can help you in a variety of ways. People don't have to necessarily drive to our building physically anymore. They can give us a call. We can help them with this pretty much over the phone. If they have email, we can actually email the comparisons. We can do phone consultations. We can see them face to face if they need to come in. We do have a satellite office in Baldwin County in the Robertsdale area. So if people live in that community, and likewise in Escambia. But again, those of you who don't live in those areas, we are able to assist you throughout the state. So it doesn't matter where you live. You know, there's a SHIP coordinator that can assist you, and we're excited about providing that opportunity. So October 15th through December the 7th, it's Medicare Open Enrollment. You know, we like to call ourselves, you know, the Cliff Notes version. If you're confused, you're looking through that mail and it just seems overbearing, you know, that's what we're hired here to do. We're here to help simplify that and make that process go smoothly for you so that you can make an informed decision that will help you. And this is a great time to do it. We're actually scheduling appointments as we speak.
Great. And do it sooner than later, right? Because I know y'all are going to get busier and busier as open enrollment continues. So.
Absolutely. Get your appointment scheduled in. You can get it done over a cup of coffee on your sofa.
Yep. Perfect. And just to let everybody know, you'll see, you probably are seeing a ticker that pops up every now and then, the 1-800-AGE line. That is actually a toll-free number. And if you call it from anywhere in the state of Alabama, it will help get you in touch with your area's SHIP program. So 1-800-AGE line, I'll be continuing to pop that up every now and then while we're continuing to discuss this. So I guess the next question, James, there's been some kind of prescription drug highlights that have been coming up lately with the Inflation Reduction Act. Can you tell us a little bit about that kind of stuff?
Absolutely. There has been some significant changes that have started taking place last August of 2022 that we're starting to see the effects of that. You know, we're starting to see kind of how this rolls out now. But back in 2022, the Biden administration, President Biden and his administration had the Inflation Reduction Act law passed. And due to that, we're starting now to see some things that are going to take effect, such as insulin. Those of us that are insulin dependent, you know, that are on insulin, those insulins, no matter what drug company that you're under with Medicare, will be $35 a month for a month supply, right, of insulin, which is a significant.
That's amazing.
It is. It's such a significant deal. You know, insulin is one of the older drugs on the market, but it costs people money that, quite frankly, it shouldn't have. You know, it's just that drug's been around way too long to still for people to pay that money that they were paying. So now insulin is $35. It took effect actually January 1st. So it's already in play today. That's happening right now. So those of you who are people will be taking advantage of that. Vaccine sharing costs from shots like shingles. There won't be any cost for those kind of vaccines. The Part D, prescription drug plans will cover those actually now at zero cost sharing. And one of the big ones, more importantly, is the Medicare top 10 drugs for price negotiation has been released. Now, this won't actually go into effect until 2026. However, this is a significant change to the Medicare market from a prescription drug standpoint, simply because Medicare, for the first time since Medicare Part D started in 2006, Medicare now will be able to actually negotiate and set drug prices. So this is going to be a significant change for people as it relates to what they pay for their prescription drugs. So we're really excited about that. I'll show you all those 10 drugs here in the next slide or so. But also in 2024, starting in January, extra help will be expanded. So we'll be able to help a lot more people with extra help. And for those of you who've never heard of LIS, or low income subsidy, also known as extra help, it simply provides assistance, a subsidy program that provides assistance for people to help pay for their medicine. So that's been expanded. We'll talk a little bit about that later as well. No more catastrophic coverage. That's a big deal for people who were going into what was called the donut hole. That's been removed as far as the catastrophic phase, which means that you'll have zero out of pocket during that phase if you run into that situation. and there will be premium stabilization with Part D. So basically, drug plans can't up their price premiums past the 6% mark over a year. Okay, so they can't just basically limited price gouging from that standpoint. And in 2025, lastly, you'll see all drug plans will cap your total out of pocket at $2,000, which is a significant increase as well.
That's amazing. This is just, I mean, at its simplest, it's life-saving, you know?
Yes.
It really reminds me of kind of AARP's origin story. Our founder, Ethel Percy Andrus, you know, the reason she started looking for, you know, she started looking for insurance for retired teachers. That's kind of how AARP got started. And the reason she did that is because she went to visit one of her friends who was a retired teacher. And that friend of hers was living in a chicken coop in somebody's backyard because she had to choose between living in a house or paying for her health care.
Yes.
And so, you know, it really hits home for me that, you know, there are people out there who are, you know, in those poverty levels who are in desperate need of life-saving medications. This is just wonderful. So let's talk about those 10 drugs for price negotiation.
Yeah. So, you know, alluding to what you were just mentioning, these are basically what I would like to call the culprits of that. You know, when people start, you know, breaking pills in half, deciding between medication and food, or paying their bills and food. These are the people, these are the drugs that were usually making that issue an issue, right? Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Stelara. These are drugs. These are some of the drugs, the first 10 actually, that have been set for price negotiation. So in other words, Medicare will no longer allow the pharmaceutical industries to set their own rates for these. They can negotiate those rates, and Medicare will set the final rate, which will certainly make a difference at the pharmacy counter and on people's kitchen table, because people now will be able to get these drugs at much lower cost and at a controlled rate, so that they can not only stay healthy, but also financially give themselves some relief. So this is a significant difference that's in the works. The drugs have been identified, and more will continue to be added as the years go on. This is just the first 10.
Yeah.
There will be more added to this in the following years.
And we'll have you on to talk about those. So.
Absolutely.
So, you know, this is a great start. It really is. But there are still some medications out there that people are having trouble affording. And you've actually got another program for that. So can you tell us about Senior RX?
Absolutely. So, you know, we realize not everybody's going to fall under a subsidy level or something like that to get help with medications. We realize that at the Area Agency on Aging. However, we do also have other programs such as Senior RX, which actually is funded by the Alabama legislature. And this is a state-funded program. And basically what it is free or low-cost prescription drug assistance for people struggling to find money to pay for their prescriptions. You know, this is an ideal program. There are some people that are retirees that have upper-level incomes. Some people that are married may have upper level incomes together combined that don't qualify for subsidy help, but they still take one of those prescriptions I just showed you on the screen, and it begins to eat at their income. It begins to kind of eat up some of that money that they had for other things. So Senior RX is a program where we basically help these folks on those medicines by doing what's called a PAP, prescription assistance program, where basically we go directly to the drug manufacturer and we get a hardship for those people through their doctor's office. So it's a relationship between us at the agency, your physician's office, and the manufacturer. And we basically connect the two of them. We do the paperwork, get it sent to your doctor. Your doctor basically sends it to the manufacturer, and you're able to get that medicine at a either free or very low cost. So we've watched this drug make a significant, we've watched this program make a significant impact on drug costs for people throughout our region who have relatively decent incomes. So that's the beauty of Senior RX is if you qualify for a subsidy, you won't need Senior RX. But if you don't qualify for subsidy help financially, this is the program for you. So anybody who's taking a medication that's expensive, and expensive is whatever that means to you, reach out to us and let us help you through this Senior RX program.
Great information. And then there's the next one is the Medicare cost savings program. So tell us about that one.
A little bit back to now the subsidy programs. There's income limits. Now there's two programs that people can use to assist them with offsetting costs. One of them, again, is Extra Help. I'm mentioning this one again because I mentioned it earlier, but I'm giving you some insight this time on what the actual income limits are. And these are not correct on the screen. I apologize for that, but I'm going to give you the actual correct income limits. Extra Help helps subsidize the cost of prescription drugs for people. Basically, you don't get anything tangible when you get this program. This program is run through the Social Security Administration. But what it does is it flags your prescription drug card. No matter who you're with, this program flags that card at the pharmacy. It's just like getting a discount on retail at the store. If the shirt was $100, at the counter, it'll give you a rebate and you'll pay $20 for it. Well, kind of think of Extra Help like that. The income limits for it is $1,842 a month for a single person and $2,485 a month for a married couple. So what it does, just to give you a picture of what it looks like, a person may be taking a medication that's $200 or $300 a month, but if they're eligible for Extra Help, that medication goes down to about $9 and change.
That's amazing.
That's how significant it is. Absolutely. And a generic will be about $4, right? So a lot of people don't realize the significance of that, but that makes life much easier for people. That program, again, is called Extra Help or Low Income Subsidy. Now, the other program is called Medicare Savings. Now, this one is run through the Medicaid office, the state Medicaid office. And what this one does, it pays that Medicare Part B premium. When you go on Medicare, you have Part A and Part B. Well, Part B, there's a monthly premium for most people. And that premium right now is $164 a month. They take that out of people's check before they get their money, right? Well, the income limits for that have also been increased. It's $1,661 a month for a single person and $2,239 a month for a married couple. Now, what confuses people about this program is people assume that Medicaid limits don't go that high, and usually they don't. But for this particular program, they've made an exception. So that means if you have $1,661 a month gross income, you're eligible for Medicaid to pay that Part B premium for you. That means that's an immediate $164 that goes back into your check. So I advise anybody on Medicare to call our agency so that you can screen or get screened for these two programs. These are very important programs.
Absolutely. Absolutely. And can you go through those, the monthly amounts? I know you said they were just recently updated. So what are the new updated amounts?
Okay. So for Extra Help or LIS, prescription savings program, it's $1,842 for a single person and $2,485 a month for a married couple. Now, resources are counted. So, if you have more than $10,000, $20,000 in the bank, because it's a federal program, they're going to count that as resources. But if you don't, then you should be fine. Medicare savings, there are no resources attached to this. It's run through the Medicaid office. The income limit is $1,661 a month for a single person, $2,239 a month for a married couple.
Great. That is so good to know. And, among the other hats and superhero capes that you and all the other SHIP folks wear, you not only help the person calling in, the consumer essentially,
Sure.
but you also are very key in training the folks who are out there selling these plans. So you are very good at, I think, didn't y'all just have a train the trainer yesterday, as a matter of fact? So,
Absolutely.
yeah.
We did.
Yeah. And so I think that that's very important to share too, are what the marketing rules are that you go out and you train the folks who are going out and selling these Medicare plans on, because there are certain things that they can and cannot do. And so we want to make sure that anybody out there who is, soliciting, trying to solicit your business, as far as Medicare plans, that they're on the up and up and they know what they're supposed to be doing. So can you go a little bit over those marketing rules for us, James?
Yeah, sure. Being open enrollment season, it's a lot of marketing going on, obviously, because these private sector plans want your business. So with that, and there's nothing wrong with that. I mean, that's just capitalism. Right. That's America. And that's fine. But we have a responsibility as beneficiaries, as Medicare recipients, to understand the rules as well. So as SHIP, what we want to do is make sure you do understand those rules, such as the educational and sales events 48-hour rule. So what that basically means is no sale event may take place within 12 hours of an educational event at the same location. So in other words, if you're at a location at the local library and they are educating you on Medicare Open Enrollment, they can't turn that into a sales event within 12 hours, right? Because the idea is they want to give people a time to think about what was said, right? They have to be fair and give people a time to basically make an informed decision. And most of the time, people are not ready to make said a decision at that time. So they're trying to give people that 48-hour rule for that what's called scope of appointment. So in other words, if an agent meets you today, they have to wait 48 hours before they can actually sell you or meet you to sell you that product or service. Right?
That's really
the 48-hour rule. Yeah, that's important because we don't want people making rash decisions. We want people to think things through, have an opportunity to look into their options. Okay. Now there are exceptions.
Time to call you guys. So
absolutely, that's right. We encourage that. Call us, let us help you, and we'll send you back out into the world. We don't mind educating you so that you can go and make informed decisions. And it's funny on this slide, if you look at the top right corner on that slide, it has a lady looking at those television screens. I know it's small, but those are stars of yesteryear. You won't see many of those commercials this year. You won't see any, actually, because they've been wiped out. CMS did not want to confuse people through those marketing commercials because they were getting really, really tough for people to make informed decisions. So if you'll notice this year, you won't see those type of commercials on television.
I think that's great. I think that, like you said, you don't want to pressure anybody into buying something that, they don't know all about, I mean, it's their, and like you said, for the most part, I actually know several folks who are in the Medicare selling plan business, and they're great people and they believe in what they do. And they're the kind of people who show up to your trainings to make sure that they're doing the right thing. So, it's all good information to know.
Absolutely. Absolutely. And this slide here just talks about a little bit more about the scope of appointment and the 48-hour rule. It just kind of lets you know agents must obtain a scope of appointment no less than 48 hours prior to presenting and enrolling you into a plan. So that basically means, they have to make contact with you. They have to let you know what the intent of the appointment is prior to meeting you. Okay. There are a couple of exceptions to that rule, such as, if you're in the last 4 days of your enrollment period, because that can be time sensitive, you may need to enroll, because of a time sensitive situation. They don't want you to miss your enrollment period. And if a person is a walk-in at an actual location, in other words, if a person walks into a Humana office, they
Mhm.
don't have to do it in that situation, right?
Right.
But outside of those, in any other environment, that scope of appointment would be an issue.
Right. Right. Okay. Great to know.
Sure.
And then there is door knocking, which
Yeah. Yeah, this one is a oldie but goodie. You don't see this really anymore. The internet and technology has kind of moved this along, so to speak. But every now and then in our rural areas of the state, you may see this from time to time. But this
Mhm.
CMS upholds the prohibition on unsolicited contacts. So in other words, people just can't show up to your house knocking on your door or showing up to your job and just kind of asking you, about Medicare information. They just can't do that. So, agents, they can only show up to your home with a scheduled appointment, right? They just because they gave you that BRC, stands for business reply card.
Mhm.
If they gave you a business reply card or a plan to contact or something like that, some type of form, that's not permission, right?
Right.
They can't do that. So in other words, people basically shouldn't be showing up unsolicited to see you to
Mhm.
talk about Medicare anything.
Right.
Yeah.
Does that apply to like cold calling too, like phone calls, or is it just going to the door or to the place of business?
It actually does. It's supposed to, but
Mhm.
unfortunately, that's still an issue for a lot of
Yeah.
people. Um, there's people who can contact you. There's people who buy like sales genies and things like that.
Mhm.
They can call you over the phone, but they can't come face to face. So it's a little sketchy there
Yeah.
because it
Yeah.
still happens a lot, but
Right.
agents and brokers personally are not supposed to do that.
Okay. That's
Yeah.
good to know. That's good to know. And speaking of phone calls, our next slide.
Yes, this is a significant change here. We're really excited about CMS's new initiatives to protect the beneficiary. And this is one way that they're doing it. They're requiring all third-party marketing organizations. So basically, what this means is anybody that Medicare has a relationship with that
Mhm.
sells plans, or anybody that sells Medigap supplemental policies, Medicare Advantage plans, prescription drug plans, agents and brokers, they have to disclose on their website, and they have to say within the first 60 seconds of a phone call, if they're talking to you, that if they don't represent every single plan that's marketed in your area, they
Mhm.
have to let you know that they do not offer plans for every plan in your area. They don't offer it. And they have to tell you that you can feel free to contact 1-800-Medicare or your local SHIP office to get information on all of your options. That is
Good.
just, that is just the most outstanding thing in the world for us as SHIPs, because what it's
Yes.
basically doing is redirecting you to us,
Yes.
which is important. And we'll send you back. I mean, we have very
Mhm.
good working relationships with reps in our area. So we
Right.
can connect you with them. But the fact that they have to tell you that we're here is a very, very important thing for us, because it's
Yes.
going to help so many more people with knowing that we're here, because we're nonprofit. We don't have a
Right.
marketing budget. So
Exactly.
we're very grassroots, but to know that we're being mentioned, now they have to mention us. That
Yes.
matters a lot.
Yes. And like you said, I mean, y'all are federally funded and y'all are using the funds,
That's right.
to help the people. And unfortunately, that means you don't have the marketing budgets like some of these
Right.
bigger
That's right.
companies have. So any way to get the word out, like today, is going to help. So that's
Absolutely.
wonderful.
Absolutely.
Great. Awesome. Well, the next thing we're going to touch on, I think, is, and this is a big one for AARP too, is fraud prevention with Medicare in particular. I know there was just recently some fraud issues around COVID tests in Medicare. So can you tell us a little bit about the Senior Medicare Patrol and kind of what y'all do to kind of help prevent and catch these issues?
Yes, absolutely. I mean, Senior Medicare Patrol has been around for a little while as well, and its entire mission on a national level, all the way down to the local level, is to educate people on fraud, Medicare errors, fraud, and abuse. That's the point of it.
Mhm.
Medicare fraud usually goes undetected, and that's the problem. It's a $60 billion problem. You know, and I said billion with a B.
Yeah.
And that's what we know about.
Hmm.
That's not the ones that we don't catch. So basically, this program is designed to educate beneficiaries and community partners on the importance of protecting your Medicare. And many people say, well, how do we do that? Well, the way you do it is simply by not giving out information on inbound calls. If someone calls you, very rarely do we ever really need your Medicare number, right?
Hmm.
Very rarely. Somebody calls you on an inbound call and start asking for your Medicare information so you can get this free back brace, free knee brace, the commercials that you used to see on television.
Hmm.
Usually those things don't end well.
Right.
Okay, so what we tell people is don't give out information on an inbound call. Someone calls you, you verify that number, you verify that person before you give up your Medicare information.
Hmm.
Um, we also ask people to check, most importantly, to check what's called your Medicare summary notices. You get this
Yeah.
thing in the mail that says this is not a bill. Some of yours
Hmm.
may be called explanation of benefits, right? But
Right.
it'll say at the top, this is not a bill, and it will have itemized all these different things that happened to you over that 3 month or so period.
Right.
We ask you to look at those. A lot of people are so excited because it's not a bill that they throw it away, right?
Right.
But the reality is you really need to take a peep into that because
Hmm.
what's on there will indicate what's being billed to your Medicare card. But
Right.
that's important because you may have some things on there that you didn't receive. We've had people call us, they have oxygen tanks, scooters, wheelchairs, they'll have beds, they'll have
Mhm.
surgeries, all kind of things that they've never ever received on their summary notice that they
That's
didn't know about.
insane.
Right.
Yeah. It's
So
scary.
yeah, and what that does is it raises the cost of Medicare for everybody.
Right.
Right. So what we want to do is monitor that stuff so that you can report it to us. If you see
Hmm.
something on there that's not right, please report it to us so that we can help you investigate it and we can get it reported to the federal government because they are looking for the bad guys. But unfortunately, we don't get anywhere near as many calls as we would like to have because we know it's out there, we know it's
Yeah.
happening, but people don't report it. Even a suspicious phone call, if you get a phone call and someone's asking
Mhm.
you about Medicare and it seems suspicious, call us and give us the number if you can that calls you
Yeah.
so that we can report it. We call those hot spots, so
Mhm.
specifically for senior living facilities.
Yeah.
Some of these people, they frequent those locations trying to engage these people, right? To get
Mhm.
them to give them information. So we
Mhm.
encourage you to give us a call, especially this time of year, because it's going to be happening a lot during open enrollment.
Right. Exactly. And like you said, and that's the thing. If someone calls you and starts asking you all this information, folks, you can always hang up.
Yes.
And you can always give James and his colleagues a call. If you're not comfortable with it, ask if you can get their number. Write down their number. Tell them you'll have to think about it and call them back. Don't give them any information, and then call your local SHIP office and talk to them and ask them. Is this on the up and up? Because very rarely anybody is going to ask you for your Medicare number
That's right.
or anything like that over the phone. So I think that's such valuable information to know. And like you said, it's not just taking money out of your pocket, but it's also, it's taking everybody's money. It's taxpayer money. They're
Right.
stealing billions of dollars of this
That's
when
right.
it could be going to, people who really do need these type of things. So
Absolutely.
speaking of money and the health and economic impact of this is just amazing.
Yes, it really is. One of the things that we're really, really proud of is the impact of our services. And now this is specific for our region down here in the Mobile,
Mhm.
Baldwin, and Escambia area. This is not for the state of Alabama. So
this is just Lower Alabama,
this
just those
is
3
just
counties.
Lower Alabama. This is
Wow.
not the entire state. So
Wow.
imagine what the state looks like if we do those numbers. Okay. So just so you'll know, we assisted over 9,000 people last program year. And program year for us is April 1 through March 31st, okay, of every year. So we helped over 9,000 people in this area alone with Medicare assistance, okay? We also enrolled 547 people on the Extra Help Program, or also known as LIS. So we enrolled, and because of those enrollments, we saved over $3 million on prescription drug costs for people out of those 547 people. That's $3 million that they were able to spend elsewhere outside of the pharmacy counter.
It's amazing.
Yes, it really is. We're so proud of that because that's the economic impact on the community that it has, but more importantly, on their health.
Yes.
Health-wise, these folks were able to afford the medicine. It made the medication more obtainable, accessible to people. And then ultimately, also, it helps the economy locally. Those people now are spending money on other things outside of the prescription, such as food, those kind of things. For Medicare Savings, we helped 760 people enroll. And through that program, that was over $1.4 million saved in Medicare Part B premiums. So that's just in 1 year. That's what we are able to do. Those 2 programs alone put about $3.5 million back into people's pockets every year. And that's just in the Lower Alabama. That's just Mobile, Baldwin, and Escambia. And then lastly, the state-funded program, which is a champion of us all, this program, Senior RX, we did $7.5 million back into the economy. Back into people's pocket and the economy for fiscal year 23.
That's just amazing.
It is. It really is. It's a wonderful thing to see on paper, the actual impact of the referrals and the simple conversations that we have. That's what it looks like on paper. Yes, ma'am.
That's wonderful, James. I mean, wow. Just everything that you said today is just so wonderful. And, hopefully folks watching this will be writing your number down and the website again that I'm showing alabamaageline.gov down there. Sure. That is the state website. So if you are not in the Lower Alabama area, you're somewhere else in the state of Alabama, go to that website or go to the 1-800-AGE-LINE number, which is up here. That's the 1-800-243-5463 number. Call that number and you will be put in touch with your, local SHIP program. And James, I can't thank you enough. I want to have you on, at least once a month talking about this stuff, because I know it's so important and, it's always changing. And, looks like this year, a lot of it's changed for the good. So that's wonderful.
It is. Thanks for having me. Thanks for giving us the opportunity to use this wonderful platform with AARP. They've been an outstanding partner of ours for years. So we're grateful of that, and we're glad to be able to get this information out. So take advantage of our age line.
Yes, please do. And don't wait till the last minute. Again, open enrollments from October 15th through December 7th. So don't wait to call one like December 5th. So go ahead and get them now before they get real busy. So
that's right. Let's get that appointment scheduled now.
Absolutely. Absolutely. Well, James, thanks again so much for this and good luck with all the open enrollment stuff. And we'll see you soon.
Thank you for having me. Goodbye, everybody.
Thanks, James.
All right.